I got you. We're live.
Got us. All right, so we are ready to roll. Happy Tuesday. Thank you so much for joining us. Gwen, we're glad you're here. Dawn, we're super excited to have you on. We're so glad we crossed paths with you. It's been a blessing for sure. And so I want to just thank you guys for taking a few minutes on your Tuesday evening to allow us time to educate some parents and get some more information about and equip parents to be able to handle with complex trauma. So I want to introduce, we have Gwen Bartley with us. She is the director over at Amazing Grace Advocacy, my fearless leader, and I'm very thankful to have her with us today and for all that she does. So Gwen, take a minute and let us know about Amazing Grace, where we are, how things are going.
Hi, everybody. Thanks for joining us tonight. We are plugging along at Amazing Grace Advocacy. We haven't slowed down one bit despite COVID trying its hardest to derail us, but we are available for you all through virtual meetings and phone and email and text and everything we can do to get in touch with you. So the easiest way to get in touch with us is through our website at amazinggraceadvocacy.org. So feel free to contact us in that way or go through Facebook and we will get in touch with you to give you support, guidance, navigation, anything that we can do to help you with raising a child that has a brain disorder. Super excited tonight to talk about complex trauma as it's dear to my heart. I'm a mom of 5 and 3 of those 5 are adopted with trauma histories. And it was a long, long road to get to where we're at today with having some success. So anything we can do to help families get to that successful place faster than a rate that I did, I am so thrilled to bring that to you. So with that, I'm going to hand it back to Renee.
Thank you. And again, she has a lot of experience, a lot of knowledge. Gwen knows who to call, what works, what doesn't work. She is on it. So if you are struggling with your kiddo as a family needing struggle with autism or IDD or even complex trauma, definitely reach out to Gwen through our Facebook and we'll be glad to put our information at the end of the call on how you can reach out and connect with Gwen in our group. We also have with us Dawn Precore. She is MSW registered and a specialist in working with adopted and foster care children with complex trauma. She's been doing this for over 25 years and working to understand how it impacts their development, their behaviors, and attachment. And we're going to talk a lot about what attachment really means and looks like. So she's got plenty of experience working with these kids and those who live and work with them. She's helped a lot of families and agencies from all over the world. And one of the cool things is she understands the whole picture and she's able to help the whole family. So Dawn, I wanted to say thank you again. And what else can you tell us about yourself?
Well, thank you. And thank you for having me. And I welcome everyone who is watching. I know if you are living or working with a child who has complex trauma and it has impacted their ability to attach, I know what a great feat it is for you to take the moment to listen and watch. So I honor that. A little bit about myself. I've been working with children with trauma, complex trauma, with the focus of attachment or their inability to attach due to the trauma for, I was thinking it was 20 years, but it's really closer to 26 years now. So I've worked, like you said, Renee, with children from all over the world who, and their parents and people who have worked with them for many, many years. And how I worked with them was in many different capacities and doing respite, doing parent training, coaching, and we'll get into some of those probably a bit later. Unless you want me to share what those pieces are at this point.
Well, you know, it's kind of understanding what you've done, but one of the curious questions is what led you into this road? You know, this is not like a typical, oh, I'm going to work with kids who've been through a lot in their life, you know, this isn't my dream job growing up. So what led you down to this road to where you are today? Because it is heavy. It is a lot. It takes a lot out of you as an individual because you become so connected with these children and what they've been through. So what was that road like?
Well, you're absolutely right. I did not learn one drop about this in graduate school. I've learned about trauma and I learned about attachment, but I never learned about attachment trauma and what that means. And I was just thinking, I had a job, and the job was to work one-on-one with children in all kinds of situations with behavioral problems. Okay, so I can do that. I had a client, he was 2 years old, my first client with attachment trauma. He's in a daycare, he's getting kicked out of daycares left and right. And I'm thinking, what? He's 2. I'm gonna go in there, I'm gonna slap a sticker on his chest, he's gonna get a timeout, we're gonna be fine. He just needs some good structure. And I got that. Oh my goodness, 2 years old, nothing worked. I was ill-equipped. I didn't know what to do. No one knew what to do. And just so gratefully, we crossed paths with people who did know what to do. And so I learned from masters in the field of what to do with attachment disorder. This child had disorder. And so from then, from this learning and learning from people all over the United States, my agency that I worked for thought I knew what to do. So they only gave me kids like this.
Yes.
So I learned from the
so we got
best.
somebody. Woo-hoo!
Right. I learned from the absolute best, the children with trauma in their hearts and their families, these amazing families, primarily adopted families. And so you're right. I had no idea that this world existed. I still struggled with it. Even at first, it's like, what do you mean he doesn't do a timeout well? What do you mean he just peed on everybody in the room, or he killed a dog? What do you mean that this won't work? Or that I tied his shoes for 2 years and he knew how to tie them. So I learned a great deal, and that's how I got started in it. And from there, it just expanded because I started working for the people that I met in the field. So it was amazing. It is still amazing. Once it clicks and you see what you're working with, then you know what, if any of us knows what we're doing, we have a better idea of what to do next.
Right. And sometimes it's trial and error because it still is so evolving.
Yes.
We'll discuss later about traditional therapies and everything else, but kids get labeled so quickly
Yes.
without understanding the whole story. And there's this black and white, it's got to be one way or another, and you're going to make them listen or not listen. And it's not that case. And when you begin to peel the layers back, get to know the child, get to know their history, get to know the family, then you can have some compassion and empathy. So, before we jump in, there may be people watching us live now. There may be people who will watch us recorded later that, the word complex trauma parenting caught your attention, maybe not because you've been through it, but because you're like, come on, what are they talking about? And we just ask you to keep an open mind, because not every child responds to, like you say, timeout, or I'm going to show him who's boss, or I'm just going to put more rules in place. So we just want to ask everyone who's watching, again, live or recorded, to keep an open mind and really understand what these kids are truly going through, so that if it doesn't affect you personally, that's fantastic. But the next time you're in a grocery store, and if you see a child having a complete meltdown in the aisle, you'll have a little bit of compassion towards that mom who's just doing her best to keep things together. So with that, Dawn, there are some things that we have questions to kind of lead us off.
Yes, I am. And you're absolutely right. And we're going to address these kinds of things of how to we're just going to think differently so we can have a different perception of maybe what's going on. But I was wondering, for those of you who are watching, if you can relate to any of these scenarios or characteristics of your lives. I'm going to ask about isolation pre-pandemic. We all are pretty isolated right now. But is having a child in your home with behavioral problems, let's say, if they have trauma or not, but if having a child within your home who is dysregulated and challenging, are you feeling isolated? Does your family and friends not want to come around you because it's just not fun to be at your house? Or do you not go to their houses because they have so much judgment. They think you're too hard or you're too soft, or they give their parenting advice to you that it's just, you'd rather just stay home. I also wonder if parents are experiencing their child showing a different side to them. Then, so you can't take them out because people will say, oh, look how cute. Oh my goodness, so cute. And the kid just had a meltdown for 4 hours at your house and you're ready to just have your head spin, and he's getting praise going out. So has that happened to you? Or even within a family, mom and dad, or however your household is with adults, does your child show you a different side of them than your significant other? Because it's the behaviors are often worse toward the mom, and I'm going to use mom as primary caregiver. If it's the grandma, if it's the dad in the family, it's typically the worst for the primary caregiver. Is that happening in your homes? I also wonder if there's stress in your marriage or relationship with your significant other. Are you experiencing depression? And I'm wondering, I've heard a lot of moms say this to me before, the primary caregivers, they don't even recognize themselves anymore. They used to be happy, and now they just are not happy, and they grimace all the time, and their eyebrows are stuck like this. They just don't know how it happened. So I wonder if any of you can relate to that, to those scenarios. And you're not crazy. You're just not crazy. And so then I wondered, do you have a child who engages in power struggles? Is your day filled with power struggles? Simple little things. You put down a fork and they're going to move it over just a half inch. That's happened. What about they're so stubborn? You just have this sense that they're so stubborn. What about they won't finish a chore or a task that you give them all the way? They'll do 90%, maybe if you're lucky, they're going to do 90%, but they're going to leave something out of anything you ask them to do. How about consequences? Do they work? Probably not, or not consistently. Do you have a kiddo who maybe cheats, lies, sneaky, steals? And I was also, sometimes we see a lot with clumsy and uncoordinated children, but I also am wondering about the final piece here is, does your child have a rage or an anger that is so big, which seems to be inconsistent with the event that's happening? They're so dysregulated with rage and anger. So I'm just curious if any of the folks watching can relate to any of these that I've said.
And from what we understand, there are a lot of families saying yes, 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 and yes, and yes. Yes, they do understand. They're like, yes, finally somebody understands. I'm not going crazy. I'm not a horrible mom. I do love my children, so I don't get it. It's awesome that they finally have somebody that can explain what's happening. And it is hard, and value them and acknowledge what they're going through. And
absolutely, it validates that. And one thing I forgot to say, and you said it, if you are moms or parents or whoever has these children, if you feel tremendous guilt because you don't like your child and you doubt that you love them, I want you to know that I understand that and I hear that, and it's okay. It is okay, even though it hurts you deeply. That's another piece that we'll get to, that we'll pull back, that will unpack for you and with you.
So before we get into more of the details, and that was expounding on that, seeing a mom, I want you to speak directly to mom and dad. What would you say to them if you just had like 30 seconds?
I would say that your child came to you this way, because predominantly I'm talking about children who have been adopted or children that you did not raise within the first 3 years of their life. They might have been your child, but maybe through a divorce or something, the other parent was taking care of them and then you got the child back. But what I want to say that the child came to you with all of this pain and I hate to say damage, but I don't mean that. They came to you this way. It's not anything you're doing. It's not your fault. You did not cause this. And we'll be learning tools then of what you can do to not make it worse and make you go crazier. But it's not your fault.
Right, because when you think of when, especially under 3 years, or even, I know some people got their kids at 3 days or 18 months or whatever the situation, and we don't know the whole extent of what that child went through. You may have a few pieces of the information, but we don't know the whole extent. So they're sent to counselors, they're sent to therapies that are traditional trust-based love approach parenting. And in these kiddos, that's like oil and water. It doesn't work. That's feeling like an attack for them because of what they've been through in their life. And so trying those approaches, everybody's telling you to do it, so you do it and it's not working, so then it's got to be the parent fault. Or you mentioned early the manipulation. You go to school, you have a school meeting with an IEP with all the teachers. Oh, they're so good. Johnny's such a good kid. Oh, we just love him. He just interacts with everybody. He's such a good mannered kid. And you're like, wait a minute. That ain't who it is at home. And then you know that that child is manipulating the teachers. So you try to talk with them, and then it comes back as bad parenting. So there's a lot of conflict even among marriages, because we don't know what to do. It must be our fault. We're not going to make it.
Right. A part of, when I know we'll get into this, I do want to add it here. Part of the healing process of a child with a broken heart is for the whole family. It's individual, it's couples, and it's working with the child. So it encompasses all of that, because raising a child with this level of stress can break up marriages.
Right. And it even causes like second trauma on the kiddos who are living in the home as siblings.
Oh my goodness,
So
yes.
They see what a home is like. Wait a minute, is this what a home is supposed to be like? So
yes.
This is what I do when I get out and have my own house?
Yes. And if there are siblings involved, it also involves bringing them into the therapeutic relationship as well.
Well, let's dive a little bit deeper and understand exactly what complex trauma is. So when someone says, your child has complex trauma, what does that mean? Because you think trauma, nobody got killed, they didn't fall out of the road, they think all these really bad Hollywood scenes.
Right.
Complex trauma.
So complex trauma essentially is kind of a build upon trauma. It means that multiple things have happened. It could be domestic violence. It could be sexual abuse. It often happens all together at the same time. So they could have domestic violence, physically abused, sexually abused. They could have had multiple caregivers in the first few years of their life, so it was very inconsistent. The child could have been sick in the hospital for the first 3, 4, 6 months of their lives. Maybe they were born premature. And so that's another component of it. But also we look at the longevity of it. So you've had these multiple pieces of trauma over a longer period of time affecting those formative years. And so that's generally and loosely what we're calling complex trauma. And that's happening regularly. It didn't happen just once this year, like a tornado happened, although that's trauma, and trauma is significant, but complex trauma is adding these other layers and longevity. And it's often perpetrated by a caregiver, the person you're supposed to love you and trust you the most. And so that perpetration by a caregiver, a parent perhaps, is so significant, and it changes the absolute worldview for the child, changes their brain, changes so much. It's huge.
But and some of the things that you were stating, domestic violence, sexual abuse, or even this one is huge, going from multiple caregivers in the first few formative years of their life, that instability. So that can even happen with a biological child. Mm-hmm. So a biological child can also have complex trauma because of what's happening in their home.
Right. Because what happens for the child is the trust piece has
Mhm.
been broken. And so if you have a child who, maybe a baby who is particularly sensitive and needs many babies need the comfort of their parent, but let's say you take them to the caregiver, the babysitter, well, they're just now getting used to that caregiver, and then another one comes in. So the child is dysregulated, and it's about the needs not being met of the baby. So like the example of a child being in the hospital. There's a baby in the hospital with loving parents who are right there, but the baby is in pain and it's not being resolved. And so it sets up this place in the baby's brain and in their whole being that I cannot trust you. The world is not safe. You aren't helping me. And that's not quite as often as this other abuses and trauma.
So let's talk about for a quick second, if you don't mind us getting scientific and geeky. So we talk about how that affects the brain. What does that do to the brain?
Well, I'm not a brain person, so I don't have all the details of the pieces of the brain, but what it does is sets up the constant survival part of the brain. That's the voice that gets heard and talked at all times. That's stimulated, and that's the biggest part that will always be on. And so stress hormones are flooding the brain and the body all the time. Because, am I mute? No, okay.
You're good.
Because the world is not safe. So I have to 100% be on guard. So that fight, flight, freeze kind of place of survival brain is 100% on. That's my worldview. So, and then what it also does, so let's say that's my worldview, my survival part back here is always on. Well, I cannot take in information the way another typically developing child would, because I'm in a different place. So developmentally, I start to, you see it in development with physical development, emotional, so forth, with education is challenging because my brain is so out of whack.
What are some of the diagnoses that, and I think of one specific, and I'll be curious if this is one that you mentioned, when you think of a child in that environment, in that mindset, both mentally, physically, emotionally, and they go to school and they start acting out and we start having all these behavior issues. What is typically diagnosed as, and it really would be an attachment complex trauma type situation, but
right. People in the field tend to not want to diagnose attachment disorder, and rightfully so. We need a in-between place, and we can talk about that. There was a hopeful in-between place. But what I see with every child that I've worked with reactive attachment disorder, or even if it was not diagnosed as the first thing that they were diagnosed with was ADHD.
mm-hmm.
And
Yeah,
it's the very first one because it's kind of like, well, it's a smaller bite to chew when they're younger. And then as they get older, then they might also throw in adjustment disorder. And then as they get a little bit older, they can throw in conduct disorder, or maybe they'd also do look at the spectrum for these children. And then as they build from that, maybe hopefully they'll look at fetal alcohol stuff, but usually it's ADD or ADHD or adjustment disorder. And that's like, what?
yeah, and there is like, it seems like every child you talk to or any kind of issue at school, it's automatically, he's ADHD, he's ADHD, he's ADHD.
Right.
So we put him full of all these medications and we don't really dive deeper. We just put this label on, we're going to put these medications in them, and that's how we're going to process everything. And it never really gets resolved. Like I say, it gets worse because you have more issues, and as the child matures, as it gets older, you have more acting out. Right. Because you don't know what's going on. That internal battle is still there.
Yes, the child still doesn't feel safe. And also, so anxiety, so the children often have anxiety, and it's true anxiety, but if you don't dig deeper as to where it is or where it comes from, a medication is not just going to fix. It might dose those symptoms some, but it will not fix it overall. And their brains are so dysregulated, they could have ADHD, but it's not true ADHD where the medication would help them. It's when the DSM-5 was coming out, there was a hope to change reactive attachment disorder to developmental trauma disorder, because trauma affects the development in all areas of a child. And this felt more comprehensive, but that got shot down. But those of us in the field will still refer to it as developmental trauma because it affects so much.
Oh, that's a lot.
Yeah, it is a lot.
It's a lot that kids go through and trying to get to the right diagnoses. And when I say, let me go ahead and put this disclaimer out here. Just because we mentioned the ADHD comparison to developmental trauma, we are not saying that ADHD is not real. We're not saying that there are some children who truly have an ADHD, whether it be due to red dyes that people are eating or their sleep habits or whatever's going on in their world. So we are by no means saying that that is not a true, accurate thing. It's the simple observation that it's the quick fix. It's the quick thing from the doctor's perspective, because they look at symptoms, they check off the boxes. So here's what we're going to do. Whereas in Dawn's field and other fields who work on attachment recovery and being able to help the family heal holistically, we peel those layers back and get to know you, get to know the child, what's best for your child, what's best for your family, and then how can we help you work through that attachment disorder. So when I say attachment, and we have brought that up a couple times, what does that mean? Because when you think of attachment, I think of, I had my baby and I'm rocking her to sleep and I'm nursing her and all this stuff. What does attachment look like, and how is those types of movements of trying to get close to my child, what does that do to a child with reactive attachment or an attachment disorder?
Right, or trauma, so traumatized that it has affected their ability to attach, even if they're not diagnosed with this. And parents, moms particularly, are really hone in on this. So moms who are listening will appreciate this if they're experiencing it. So we know attachment, healthy attachment. If you're nursing your baby, they are snugged into you, they are looking at you, you are touching each other, and just so yummy hormones are released for you because it feels yummy. Well, let's say you have a baby, and I will go up to even older children and give examples. But if you have a baby who has complex trauma, they are not going to nurse, or they are not going to feel that they want to take anything from you. So I've had babies who were not a little tiny infant, but maybe 5 months old. I've had parents call me and say, okay, here's the problem. I'm trying to feed this child with a spoon. Here's the food. And he's pushing me away, and he's pushing the food away. The child doesn't want to take anything from the adoptive mom. It's not safe. And at one point, well, that's a whole other story. So we know what attachment needs to look like. We have those warm, fuzzy feelings. So if you've got a child in your home or that you're working with that seems to, they stiffen up when you want to hug them, they don't make good eye contact with you. Now, it could be other things. We are not saying all these behaviors are attachment-related trauma. It could be many other things. I'm giving a global, we're not diagnosing, we're just giving a global, here's some characteristics. They do not want to snuggle with you unless they want something. And touch, you are the enemy to them. Again, the stiffening up. Or if they have to hug you, not only are they going to be stiff, but maybe they're going to pinch you or do something yucky to just have you push away from them. They also don't take in your brilliant wisdom as a parent. So little kids or 8, 7 years old, they want to listen to what you have to say, and you're teaching them. These little kiddos, they know everything, and you cannot tell them a thing. They don't need you. If you have a child and you feel like they just feel like they don't need me, those are some of those characteristics.
And you would say those ages, because as soon as I think of that, I think my adult kids, you go through that phase, and teenagers, oh, I don't need mom and dad,
Right.
So this age would be consistent of under 13? because 13, they kind of change anyway. That's a typical neuro teenager. We're like, I don't need mom and dad, and I know it all. So what age are we referring to in that spectrum?
From babyhood to, I don't want to give exactly 13 because the developmental phases of the children are so different, even though they're a teenager, and it would be typically a time to launch and developmentally time to pull away. Often they're so immature that it takes a little bit longer for them. But I would say you would notice these behaviors, yes, from birth to 13 years old, 14 years old. However, let's say you have a child who's a teenager and they have had attachment and they've had trauma throughout this whole time. Teenage years are a bazillion times worse than what you would see before because their conscious development is weak, and it just is a hot mess when they are teenagers.
What's an example of that?
They so dislike a parent more than a regular kid who's just, a teenager and thinks they know everything. But they may engage in more risky behaviors. So if they're more outward with their rage, then they may be stealing a car, or they may be engaging in higher risk behaviors than other children who are teenagers who do engage in risky behaviors anyway. And if it's a child that was more internal, you might see cutting during this time. They might do cutting and things like that for self-harm. And it's just hard to live with them. I mean, it's, gosh, no matter what age, if you have a child who doesn't trust you and who doesn't feel safe, it's very hard to live with and work with.
That's the one thing with kiddos in these families is safety is the number one thing for all families, for the whole entire home. It's siblings, mom, dad, and the kiddo with the attachment struggles, with the complex trauma. So safety has to be the top priority, and we have to work on making sure everybody's safe.
But there's a whole different world of safety. Yes, and so safety for everybody, so nobody is able to sexually abuse a sibling or harm a pet or these other things that are big safety issues. And there is a deeper level that is the thread through complex trauma is felt safety, psychological safety. So the kiddos are reacting to the world, to the people in their world, because they don't feel felt safety, even though you are awesome moms and dads who love these children and have opened your heart and home, and they are your child. They do not feel safe. So they don't have a sense of felt safety. Even though you're not harming them, you're feeding them, they don't feel safe. So they are each day, each second, seeing the world through that. And if they can con you, if they can manipulate you, if they can get you to repeat yourself, if they can get you frustrated, angry, if they can do all of those things, then you are not safe. Because what they'll see is, look at me, the cute little kid here, got you all red in the face. Look at how powerful I am. So the safety piece is gigantic. I'm passionate about that, and we'll talk more about that for sure when we get together in February. But it's not just safety in the home, it's a felt safety.
And they're really good at that. It's like, to them, it's a game. I've heard parents say it's like they go on and on and on and on and on, and they know exactly what to push and get you to the point to where you explode. And for them, it's like, chalk one up for me.
Well, if I can share a story about that, can I do that?
Absolutely.
So for them, I thought too it was a game. And this one little kiddo, he was maybe 10. He educated me on what it was. So I used to bring the children into my home and work with them on behaviors. They would stay with me from a few hours to, some stayed a year and a half, but usually to a few days to up to a week. So he came to me because he was having a hard time at home, and this therapeutic respite is is what I did. And but that's a whole other thing to explain. So anyway, he's at my house and he needed to do whatever I told him to do, and he's just not going to do it. So I told him I decided to hit his resistance head on. I either dance with it or hit it head on. I'm going to hit it head on this time. And I told him to do 5 A+ jumping jacks. And there's a particular way to do those, and they have to be perfect. This is not a power struggle. This was a therapeutic scenario. Okay, he's not going to do them. Of course he's not, but that's okay. It's his struggle. It's not mine. So finally, he said, this isn't working. And I said, what? He said, you're not getting mad. And I said, tell me about that. He said, well, I just keep doing this and my parents would get mad. And I said, oh, so it's a game, like a game to you. He said, oh, no. Oh, no. He said, this is war. So he's in a battle. And it was so, I get chills thinking about it. I can still see him. And from that point on, him being in my home, he was 100% compliant because I had passed this test that he had, which they test everybody every second. But for him, it was war. And unbelievable. So it does feel like a game. It does. It is sad. But his very safety depended on controlling the adults in his life. Mm-hmm. And so part of the healing is helping them to feel safe. We can't tell them it. We can't say the words because it's in their brain that's been shifted, and words won't work. That's why traditional therapy doesn't work for them.
So to finish that kiddo, because I don't want to leave mom and dad's being like, oh, that's where I'm at and this is never going to work. Tell me what happened to that child. How's he doing? How did he do? How the family
went home, and he was he was a mess when he went home. And the reason being is because he showed a vulnerable side. And when a child shows a vulnerable side, they've got a, oh my goodness. That's why having a birthday party for your kid, or if there was a moment that you and your child connected for 5 seconds, he will melt down right after because they can't handle that vulnerability. The child went home, it got worse, it got worse, it got worse. And one of the pieces there's several pieces that have to be in place for healing. And one of the pieces that weren't in place was enough support for mom and dad because they had already crossed over to, I'm not doing one more thing for them. So they did not take on this this difference in parenting. They wanted to use traditional parenting in a child that it doesn't work for. And so it just kept creating this cycle.
And you hit the nail on the head because people say that we've invested, we've done everything we know to do. We've been to all these counselors. I can't do anything else because nothing works. Yeah. And it's like trying to go to the knee doctor, but he's giving you medicine for your heart.
Right.
It's just the wrong communication. So if we can get you the right therapies, if we can get you the correct way of connecting with your child, and not, I don't say connecting, but in a way you're teaching and you're learning to attach or learning to work through. We're helping the child on their level where they are. It does get better. It
does. And you're absolutely right. Parents are amazing and you want the best for your child. And so you do what the professionals tell you. You'll take them all over the place. You do it and you do it and you do it. In the meantime, you're being abused in your home by your child. Your child's abusing you. You're exhausted, but you're still out there doing it. Years can go by. It erodes your energy, your everything. And so I'm so grateful that you, Renee, and Gwen are offering these kinds of sessions for people so that they can see, oh, wait, somebody might understand my language. So it's remarkable. And sometimes it takes years and sometimes it's too late by the time they get the right kind of help. However, they can heal.
So you've worked with families for 26 years. What is an example of a family that you're like, okay, here's this kiddo with an attachment and you went through the therapies. How did it start and how did it end so that parents can hear there is hope, there is a revenue, there is a way to work it out. So what does that look like?
Yes. This is one of the great examples. So the family came from Tennessee, drove 3 to 4 hours to get to us for therapy. They had adopted a child from China. they're in with Bill, the psychologist. I'm doing the behavioral stuff. The kid is screaming their head off. And the parents are like, oh my gosh, what is she doing to my kid? And Bill said, she's doing washcloth therapy. She's having your kid fold washcloths. So anyway, that's a funny story about that. But this child was, I think, 4 at the time. Okay, so by coming to a therapist that understood what to do, a behavioralist, me, who knew what to do, and at the time I was also doing respite, which is another component that's needed, therapeutic respite. More than what people would understand a therapeutic respite provider would do. The child's doing therapy basically for 12 hours on their behaviors and so forth, and lots of support. Anyway, through the course of that, having really strong parents who are listening and doing what we ask them to do, and then adding in other things like neurofeedback and these other components to change the brain, this child is in medical school now. Yes. And the family got brave enough healing had taken place that they wanted to adopt another child. And so I went with one of the moms to China to be able to start the attachment the second the baby was given to the mom, so I could work with her from the beginning. And that child wrote a letter a few years ago about how much, and she had attachment trauma, of course. She was in an orphanage. And she wrote a letter a few years ago about all the therapies that she had to do and how far she's come and how grateful she is. And she is healed. She got like an award in school for the most, I've forgotten, like not most social, but most congenial person, which is like, are you kidding me? So they can heal, but it takes a team to heal the child with trauma that affects their ability to attach. And it takes other therapies, but don't get overwhelmed by that. We're starting with one thing at a time. Let's acknowledge and validate that you have a child that is breaking your heart, and your child has a broken heart. And here you are.
And like you say, don't get overwhelmed, because that's where we can come into play to help you connect. It's seeing that there is availability to help your child and your family heal, that you don't have to stay, because so many parents feel like there's no hope. There's no chance of anything happening. My child's going to end up on the streets, or going to end up homeless, or they're going to end up in jail. You know, parents, and I'm sure moms, dads, if you're watching, you're like, yes, I feel that way, and I don't know what else to do. So the good news is, you've heard it straight from someone who's been doing this for 26 years. There is hope. There is a way. There is a route that can help you get from point A to point B to DC, all the way down to success. So your child will live a full life, and you will be able to see growth and not have to worry about despair when they move out of your home. So that's so exciting. That's so exciting to hear.
It is exciting. There is hope, and many children have healed fully, and many have healed where they are functional adults, and we now don't have to worry that they are going to be on the streets or be a prostitute they are the one child I worked with almost the longest she is at a community college. She will struggle always with relationships. She will always need support, but she is at a community college. She can take my feedback in conversation, and but I'm her person. Of everyone in her life, I'm her person. So finding even another person they can connect to heals a person. So
you mentioned one thing we discussed about the whole family.
Mm-hmm.
So when we find the right connections for the kiddos who have had some complex trauma, and we're starting to connect them with an attachment therapist or neurofeedback or whatever's going on, respite, the right kind, what does healing and support look like for brothers and sisters, mom and dad, grandma, grandpa? What does that component look like?
That's huge. One good thing, moms and dads out there, or primary caregivers, is that the interventions that I'll be teaching in February can work with all the children in your home. So you don't have to think, oh, I've got to learn this for this kid, this for this kid. It can work with all children, which is super exciting. But what it looks like, first of all, it depends on how much damage has been done in the family, and safety is the first thing. If the children are not, if this child is sharing a room with another child, these kinds of logistical things will need to shift to start with, because that's just not safe for anybody. So making the whole family feel safe. If the pet, if your identified child, I should say, is not safe with your pet, don't give them the chore of feeding the animal. You know, we're going to look at those logistic things. So then after that, we look at the primary relationship, and that needs to be between the child and their primary caregiver. That's where the break happened. That's where the healing is going to happen. So we tend to not have them hanging out with grandma and grandpa yet. We want to, it's like when you have a baby, you make the world really small, and as they can handle it, you loosen it up. If they can't handle it, you just pull it back. So it starts with that.
Like a rubber band effect.
Yes, and no need to panic. This is all steps of back and forth, a natural way of life that you don't even think about. If grandma and grandpa are in their life, then grandma and grandpa need to learn these interventions so they're not inadvertently sabotaging in an area that they didn't mean to, because they're like, oh, they just love the kid so much and they give them a lot of sugar or something. We just look at all those pieces. And then we also look at developing your time with your other children and making that a priority, because what happens with the identified child is they get all the attention. And so we don't want to leave anybody out, and providing space for your other children to be able to have some time with the therapist too, and say, gosh, I don't like living with my brother or sister. And it's okay to say that, because who does like living with that kid? Nobody. It's, he's not likable right now. So
and you're right. And then also in helping those kids to see that that's not what a typical mom and dad relationship looks like. Helping them work through their frustrations and their expectations and anger, and identifying and validating them where they are. Say, okay, we get it. You didn't ask to be in this stressful situation, so let's help you. Let's help you come out stronger on the other end. And what does a healthy relationship look like? What does a good home look like? So that as they get out of the house, they're not repeating the same generational cycles. That even though they weren't abused or left, they picked up on that because it's what they know. And then helping mom and dad put that relationship together so that when the kids are gone, they still have their life to live to the fullest.
Yes, we don't want to ignore them because the other child's getting all that attention, and to help them, it's about relationships. So everybody healing in the relationships within the family unit is very important.
So that we are coming up on almost an hour, and I am so thankful that I think we covered a lot, and I know a lot of the parents, they agreed on the ADHD. I'm going to jump over and see if we have any other questions regarding, let's see. So one mom said that no matter how many times I explain RAD or other disorders to family and friends, they don't believe me and think I'm the parent that is too strict.
Oh,
Have you
yes.
heard that a lot?
Absolutely. You are too strict. You're crazy. You just got to just hug them. And yes, it is. You are absolutely right. People don't get it. And it's surprising that they don't believe it. Like, how did this become a belief system? Yes, because your child is different to you than they are to anybody else out there. You get the brunt of it.
Yeah. Another one says, Heather says, this offers hope to many. If I'd had the chance to access a healing team like this, I potentially would not have disrupted a long-term adoptive placement. I feel horrible about that. So speak to Heather right now and help her as she's processing that grief.
I want you to know, Heather, that I 100% understand. If you had the tools that you needed, because I know that you sought help from everyone, everywhere, and they did not speak your language, they didn't understand it. And I recall a story of a mom in Tennessee who adopted a child from Russia and put that kid on a plane by themselves back to Russia. Everybody was just up in arms about that, and I understood it completely. Of course they did. So you have your own trauma that you're healing with right now and dealing with because of that. And for that, I'm sorry. And I hope you can heal from that part. Your child came to you with so much pain, and you went for help and nobody helped you the way you needed.
Mhm. And having that compassion, giving yourself grace, you did the best you could with the knowledge that you had. And that's where people such as Dawn and other individuals were finding these little gold nuggets. And when we find these nuggets, we're trying to connect families with someone like them in their area who can help them. And having parent trainings that we can teach and equip you as much as possible. So give yourself grace, love on yourself, and it's okay. You did the best you could, and you have a heart of gold. So please don't spend another minute feeling bad at all.
I have no judgment about that
Mhm.
for you. I get it. I so get it. When I had a child living with me, I thought I turned into somebody I didn't know. I thought, gosh, this is awful.
Somebody mentioned our RAD sexually abused our younger daughter, our younger son. How do they move forward?
How does your younger son move forward? Is that what the question is? Or how does the whole family?
Stated, how do we move forward? So I would see it being as the younger son who was abused, as well as the
Gotcha.
RAD and the whole family. What would be?
That is so huge, and I see it often. And there is a way to move forward from that. I know there's a tremendous amount of guilt and pain associated with it, and I'm happy for us to talk more about that in detail of your specific situation. But if the perpetrator is still in the home, your other child, then moving forward with safety is huge. And I don't mean just safety. It means alarms on the doors. It means all kinds of different ways to set up your home. Not like a prison, but still like a family, which is not in any book. So I'm happy to talk to you more about that. And I want you to know that I hear about this pain quite often, and there is a way to heal from it, but it does take a long time.
And I have, I know of a family who has experienced that, and they are currently in counseling with the child and the primary caregiver. They're doing attachment therapy, and they're focused on what she went through, why she acted out, how she could get healing. And what's been amazing is your mom say she's aware of, I can't go to my bedroom with a friend. That's not a good idea. We can't have the lights off in our room. That's not a good idea. Whereas before, she wasn't thinking. She wasn't able to look at it from that perspective. So part of her, and she's also doing neurofeedback. So between the attachment therapy and working to help her with the sexual abuse and things that happened to her as well as to others that she did, it's helping with the feedback. So there is healing available. There is help available.
And for the mom, sometimes EMDR for the parents'
Yes,
trauma,
yes.
because you have your own trauma from this, and guilt and pain and so forth.
EMDR is, if you've never had it, the best way to describe it is when you, and I've done it, and it's amazing. I love it. And anybody tells me they have trauma, I'm like, I'm getting you set up with someone who has EMDR. When you go back and talk with a counselor and you bring up a memory that was hurtful, whether it be as a child, it could be a simple abandonment, it could have been as hard as sexual abuse. When you talk about the memory, the body remembers what you felt when you went through that situation. The body doesn't forget. The emotions start to come into play. The anxiety, the fear, the hurt, all of that starts to come bubbled up from the inside. So then we start to push it back down because we don't want to talk about it. It hurts. I don't want to face it. So we keep it all suppressed, but it eventually keeps coming up. And so when you're holding the devices during the EMDR session, you're talking with your counselor, but you're holding these little devices that is kind of like a stimulation, and it can be as low or as high depending on what's comfortable for you. And as you talk about the memory, it separates the emotion from the memory. And it literally, it's like it releases you and you're able to talk about it and process it. And those feelings, like they go, they are released. It doesn't control you anymore. And so my aunt went through it, and she remembers some things that happened, and she went through 2 sessions and forgot what the memory was that was causing her to have the anxiety and the fear of nighttime. when that memory came up, they had the EMDR session going. It worked. It released it. She's no longer scared of the night. And she was a grown adult when this happened.
I want to add two things with it. EMDR is eye movement, so it can be tactile, it could be auditory, or it could be eye,
Right.
this bilateral movement for the brain. But it releases it, and what it does, though, is it files it in the right filing cabinet in your brain. So it's still, it could be accessible if you wanted to take out the memory and look at it, but like you said, it separates it because the emotion from the memory, because right now you're so triggered by it that it's in a different part of the brain.
Yes.
So EMDR helps file it.
Yes.
And it sort of parallels what happens when you sleep with your REM sleep at night.
Mm-hmm. Yeah, it's phenomenal. And so that is the best anybody with trauma, especially adults, especially parents going through what you are as a child, as raising a kiddo with attachment. So we try to look after the family at Amazing Grace. We look at the whole family. We look at what's going on in your world with kiddos, with school, with doctors, with siblings. How can we help you as a family? So we've alluded quite a few times about a parenting event. So let me explain that a little more. It's on our Facebook page as well. But on Saturday, February 6th, which is in 2.5 weeks, we are going to have a live Zoom parenting session. And Dawn is going to facilitate it for us. It's going to be from 8:30 in the morning until 11:30 in the morning, so 3 hours. And I'll let Dawn explain a little bit more, but what we've done is I've seen Gwen has posted it in the chat that you can go register on our website. Again, it's on our Facebook page as well. So if you scroll down to the February 6th event, you can just click Get Tickets. It takes you straight to our registration form. If you sign up before February 1st, you save $5. We're all about saving $5. So it's regularly $20. We're not trying to make any money. We're just covering costs, and we're making it as accessible as possible to you and your family. So that's a pretty good deal. 3 hours of in-depth, talking about what's going on in your home to give you some good tools and at a very inexpensive price. So if you sign up before February the 1st, you will only have to pay $15. So that'll be for you and your husband. So Miss Dawn, or your caregiver, whoever the primary caregiver is. So Miss Dawn, will you give us a look at what that first session is? And then we'll explain a little bit more about two more. We haven't advertised the other two sessions, but we do have more in-depth parenting sessions available, but we're going to talk about the first one.
So the first one is a foundational training, and we're going to talk a little bit more about trauma and build upon it, because the big piece of this training is to give you parenting interventions, to give you the tools that will work, will hopefully work. Some do what works in your home, but these are some tools that are not traditional parenting techniques, because you already know, you've tried all these techniques. Stickers don't work, star charts, all these consequence things that schools love don't work. So it's going to give you some take-home tools. I need to set the foundation of trauma first so that you understand why we're doing these interventions the way we are and what our bottom line is. So it's going to help you stay out of power struggles. That's a big one. It's going to help you to empower yourself so that you're not feeling so like you're going to strangle your kiddo any minute. So we got lots of cool interventions.
And then once we finish the first one, we will offer two other ones. They'll be a little bit more in detail. Once we get past the first one, what does that look like?
So once we get past the first one, so it's a lot of information, and I know everyone won't be able to absorb it, but I'll give you some take-home homework so you know, okay, I can work on these 5 interventions. The second and third one are definitely more involved, and they require that you are seeing an attachment therapist, because what this will entail is practicing these interventions, how to have them work together so that you're actually working on connecting and healing and providing a safe, psychologically safe and felt safe home for your child. And so they're definitely, and you'll get a chance to practice, you'll get a chance to understand bigger concepts about when I said you hit the resistance head on or you dance with it. So it's more broader and detailed.
Right. So we have, once we get past the first one, which is kind of top looking down, give you some interventions. But if you would like to move forward with more in-depth help in your home, we can help you with that as well. So if you're in state, let us know. We'll connect you with an attachment therapist. If you're watching us and you're out of North Carolina, that's okay, because guess what? We know people. So if you, wherever you are, send us a message, reach out to us on Facebook, send us an email, and we will try to connect you with an attachment therapist in your area. Now, it may not be 30 minutes up the road. It might be a little bit further, but it will be worth your investment. And then we'll connect you. Then it will connect us with sessions 2 and 3 of the Parenting Foundations.
I would like to say for this training coming up, you may consider inviting whoever else is in your child's life that needs to hear the information so that you're working together, because you don't want the child to fall through the cracks, essentially, like you send them over to the babysitter's house and they are not doing the consistent things. We need to make your child's world consistent. So whoever your person is that you want to come bring with you and other people to hear all the same things at the same time is super important.
That's really good. That's very good information. And the very first one, again, everything is Zoom, even the second and third one. So no one has to worry about social distancing. If you're here and grandma's in, 30, 40 minutes away, or even in another state, they can still hop on. And that, like you say, everybody is still consistent. So I love that idea. We can think about that.
Yes.
So let me see if anyone else has any other questions.
Okay.
Looks like we are good.
Okay.
Dawn, thank you so much. And there's Gwen. I am super, super excited from all the feedback we heard today. And hopefully, if just one family feels some light at the end of the tunnel, it's going to be worth it. And if we can start helping stop the generational trauma, keep it and just stop it in its track, it's going to be so worth it. So Gwen, what was your take?
Oh, Dawn, you were just hitting the nail on the head. And I was watching the conversations with the parents on, and myself included, just, yes, preach, like, and it is our own language. There's not many professionals out there that really understand this. And that is the frustrating aspect of it, is that not only are you going through extremely difficult daily activities in your home, but then being dismissed by professionals, not being recognized, at schools, it just beats down on you as a parent. And you're right, it ends marriages. It makes siblings have their own new set of issues. It just absolutely can get in there and destroy a family. But I always want to give the silver lining. I'm on the adult side of it now. My children are all over 18, and we survived. Wasn't pretty, but we survived. And I enjoy the heck out of my son, who really gave me a run for about a decade. He's now 20, and while he still has a lot of issues that are related to his reactive attachment disorder, we have built an attachment, we have built a bond, and it's different. Not everybody would look at it and say, oh, that's normal. But you know what? It's great. And I just want to give hope to everyone out there and know that this is a long road. You do have to put work in. It is not easy, but the payoff is incredible. So Dawn, thank you so much. And Renee, thank you so much for getting this together and hosting tonight.
Thank you.
Absolutely. Thank you guys. Again, check the chat. If you have any questions, reach out to us, and we look forward to hearing from you soon. And we are done. No live stream.
Okay.